Thank you, everyone that's joining us right now. We're going to wait another 30 seconds while we get the remaining attendees that registered for today's session. There's a couple more trickling in, but I believe the majority have joined at the moment. We can begin today's webinar.
Thank you for joining us today for the updated College Alcohol Intervention Matrix, CollegeAIM, What Colleges and Communities Need to Know Now webinar. This webinar is a collaboration of the National Institute on Alcohol Abuse and Alcoholism, the International Town and Gown Association, and the Association of Fraternity and Sorority Advisors. The ITGA is a membership-based organization that provides resources and professional development opportunities for addressing the common challenges, emerging issues, and opportunities between institutions of higher ed and their host communities. My name is Beth Bagwell, and I'm the Executive Director of ITGA, and we welcome you to this webinar. Now I'm going to introduce you to Diana Cole, Director of Education and Programs for the Association of Fraternity Sorority Advisors.
Thank you so much, Beth, and hello to our AFA members and also our fraternal friends and campus colleagues who are doing work in prevention. I am thrilled to be able to be a part of today's program and offer this as a development opportunity for our members. When Beth reached out in regards to this partnership, I immediately said yes, because navigating student safety is important, and we need to make sure that we are utilizing prevention efforts that are not just individual fraternity and sorority life offices, but are partnership across campus and in communities. It is our hope today that you can dive into the core competency of student safety and really think through the support methods that are out there so that we can continue to provide environments for students in the fraternity and sorority communities to thrive. Thank you for joining us, and I hope when you leave today, you have a reignited passion for prevention partnerships, and as you enter into fall planning, have opportunities to work together to create spaces and places for students. Thank you to ITGA and NIAAA for this partnership, and we look forward to continued educational development together.
Thank you, Diana. So a little bit of housekeeping before we get started. Please type any questions in the Q&A, and the panelists will answer them toward the end of the webinar. And I will send you a post-webinar survey within an hour of this webinar and after the webinar is over. And we just ask you to please take 5 minutes to fill that out to let us know what other kind of programs and services you'd be interested in. I'm going to turn this over to Fred Donadeo, Communication Director of NIAAA. Fred, would you get us started, please?
Yes, thank you, Beth. And on behalf of NIAAA, thank you to everybody who's joining us today for the webinar. As some of you may remember, if you've been in the field long enough, NIAAA has maintained a robust college drinking research portfolio for many decades. If any of you can remember back to 2002, we had a college drinking task force that was comprised of college presidents and researchers. And that group released a comprehensive report that is still available, by the way, on our website, if you want to go back and check ancient history. It's called A Call to Action, Changing the Culture of Drinking at US Colleges. And it's important because this report included a very simple chart that grouped commonly used alcohol interventions into different categories of effectiveness based on the peer-reviewed literature. Looking back, this simple chart was, in fact, the precursor to what is now CollegeAIM. In subsequent years, we had created a college president's working group whose members asked us to create something a little more robust, a product that would analyze the costs associated with these interventions along with the levels of effectiveness. At that point, when our college presidents were asking us for more information, we knew that we were onto something. And we reached out to 6 of the most respected and distinguished researchers in the field to serve as developers of this new product. 2 are on the call today. So they divided into 2 different teams, one that focused on individual-oriented interventions and another to cover environmental-oriented interventions. You'll hear more about this soon. We also asked an additional 10 experts to serve as reviewers of the work that the 6 developers created. So CollegeAIM, again, the College Alcohol Intervention Matrix, was released in late 2015. This is the original CollegeAIM. It was released in 2015 after a multi-year development effort. It was, and it remains, an easy to use and yet comprehensive tool to help schools address harmful and underage student drinking by directing them to effective evidence-based intervention strategies. And again, going back to the request from the presidents in our working group, it evaluated common interventions according to a number of factors: level of effectiveness, costs, and even other factors. Now, the original CollegeAIM was distinctive, we believe, because of the breadth of its research and analysis, the expertise of its contributors, and its user-friendly format. Specifically, I'm talking about the fact that it includes an extensive review of decades of scientific literature. It rated nearly 60 interventions, and it included 2 user-friendly matrices and other resources. So that's the original CollegeAIM. A final point, and this is the reason we're actually here today, is that as valuable as CollegeAIM was, we knew then that to remain relevant, it needed to be updated periodically in order to ensure that it always captures the most recent research and that it features the most current ratings and analysis. So 2 years ago, because these things take time, we embarked on an ambitious update project, at least ambitious for us. And we were very fortunate to line up the same 6 original developers to oversee this important revision. And the results, as we may expect, are very impressive. The revised CollegeAIM, about which we're talking today, now draws from peer-reviewed literature through the year 2017. It adds 7 new interventions to the original 60, and it features updated ratings for 5 of the existing interventions that were included in the original version. So with this important update, CollegeAIM remains as relevant and useful as ever, and we're excited to review it in today's webinar. I'll now turn it over to Dr. Jason Kilmer, one of those notable 6 original developers. But first, I'd like to really extend my deepest gratitude to ITGA and to AFA and to all of today's speakers. Because CollegeAIM, we believe, and I think evidence will show, is a very valuable product, but it's only useful if college administrators know about it and are comfortable using it. So today's discussion and others like it will really help spread the word. Thanks again for joining us, and please share what we discussed today with your colleagues. And I thank you so much for joining, and I'll hand it over to Jason. Thank you.
Great, Fred. Thank you very much. And good morning, everybody. Good afternoon, depending on where you are. I'm Jason Kilmer. I'm an associate professor in psychiatry and behavioral sciences at the University of Washington. You're going to hear from all 3 of us, but I'm going to ask Jess and Alicia to unmute just so they can introduce themselves briefly as well. Jess, I'll tag over to you.
I'm Dr. Jessica Krantz. I'm an associate professor at the University of Oregon. And Alicia?
All right, well, good afternoon, everyone. My name is Alicia Baker. I'm the Assistant Director at Gatorwell Health Promotion Services at the University of Florida, and I'm also serving as co-chair for NASPA's Alcohol and Other Drug Knowledge Community. It's great to be here.
I just want to say I appreciate people making the time. I have a slide acknowledging the leadership at ITGA and NIAAA, as well as folks with AFA. when Fred was reminiscing about the rollout of these things and mentioning that the Call to Action Task Force report that came out in 2002 was really the first review of what works in impacting college student drinking. I remember the first person that reached out to me to say, hey, there's science in there. I want to figure out how we can bring this to our Greek life. Was Dr. Lori Hart, who I believe is in attendance at this. And I was like, this is great, because as someone who's Greek myself, I lived in my chapter all 4 years as an undergrad. I'm a DU. I loved that people were saying, yes, it's worth paying attention to what the science says about how to impact people in fraternities and sororities and beyond. And I think that's really cool. So I also just want to thank and acknowledge all of you for making the time to do what you do to support students. If you are participating from Office of Fraternity and Sorority Life or Greek Life somewhere on a college campus, there may be more of a direct sense of what can be done to impact campuses. But for those of you joining from headquarters, the influence you have is immense. And I'll do all I can. And I know my co-presenters will do the same to really talk about how this can be useful for all of you. I feel like I'm just giving shout outs to people now. Rich Lucy, who's been a champion for alcohol prevention, and particularly on college campuses, now with the DEA. The last time I saw him in person, we were reviewing great moments in history in prevention. At first, how's that not a TV show? Because I would totally watch that show. But we started in the 80s, which were awesome. We could have started in the 40s. Jess, I was trying to remember, I feel like you and I were in Susan Library getting this original article for an article we were working on. It turns out the first article ever written about college student drinking was from 1945. There was no PDF. It didn't show up online. Jessica and I had to do a special order, and they brought us the book, and they're like, here's this super old journal. Be careful, because it smells. So I totally smelled it, because that's what you should do. Fun tip, never smell history, I think, is words to live by. But there are parts of this article that could have been written yesterday. There are parts of this article that are comical when you read it today. And it was also not only the first article on college student drinking, but the first that mentioned Greek life. Dr. Fry said the big troublemakers on college campuses were faculty, saying these parties are often attended by faculty members, some of whom are selected to respond to the chant, old professor, stick their name in, is in the alcohol ward, say their name again, drink, drink, drink. Cheers or moans and laughter follow this performance according to the speed which with the professor finishes the drink. They say they do not occur often, but are part of the life of colleges and are accepted by the community as such. I show you this because we would never accept that today. And having worked with a number of Greek chapters, there's that, you often will hear people go, well, that's a tradition. It's been that way forever. It doesn't have to be. If there's a high-risk event that you want to work to change the culture on, it can be done. We have documented proof that it happens and can be done. Dr. Fry goes on to say that wine is often served at fraternity dinners in the hope that members will learn to appreciate proper wines with food. And that although milk and soft drinks are extremely popular in American colleges, the consumption of them being greater than other beverages, a special snobism is sometimes to be associated with the appreciation and knowledge of fine wines. But Dr. Fry goes on to say, heads up, anyone reading this article, I'm starting to worry that a state of intoxication might be the point of some of these events. And maybe we should figure that out and figure out what to do with that. He goes on to say that as World War II comes to an end, we should look at ways to support returning veterans, especially as they look at ways to cope. That remains relevant. But jump forward to what Fred said. This call was made in 1945, but there was not enough robust, well-controlled studies to say, here's how we can make a difference until almost 60 years later. Jumping forward to CollegeAIM. The goal of CollegeAIM was to see what can we do to make sure science drives what organizations do when they're looking to impact student health, and if they're trying to be mindful of budgets. What can we do to increase the likelihood that science will inform what campuses or other groups pick? Fred made reference to two different development teams. I was honored to be on the individual focus strategies team. We had two teams, one that was led in the initial CollegeAIM by Dr. Mary Larimer, and Jessica and me at the University of Washington. At the University of Minnesota, there was a team led by Tracy Toomey that organized environmental strategies. When we started doing the prep on the CollegeAIM update, Jessica had moved to the University of Oregon, so it slightly shifted the dynamic, but all 6 players were still the same. When it became clear the role that Jessica was playing, Jessica became the lead of the individual focus strategies team. But again, very noteworthy is that all 6 players were still the same. When I was making the slide and looking at the documentation, it also allowed me to reflect on my experience losing my friend to Eugene, because initially when she got the job, I was like, wow. And then when she moved to Eugene, I was like, oh, and that's how it works. But phase 1, we did this amazing process of identifying what interventions are we going to include in CollegeAIM and what are we going to code them all. Once that happened, phase 2 involved identifying, reviewing, and rating articles. And ultimately, almost 60 interventions were rated on multiple dimensions. Jessica's going to talk more about some of the exact decisions we made, especially on the individually focused side, but the type of parameters included relative effectiveness, amount and quality of research, relative cost, barriers people might encounter, staffing expertise, strategy level, public health reach, what population it was meant for, short and long-term effects, and the main modality. Phase 3, to me, is what really sets this apart. I mean, I feel like it's pretty impressive if you can get 6 people to agree on something and say, we agree with everything here. That wasn't sufficient. Usually when you publish for a journal, you'll send it out for peer review, and maybe they'll have 2 or 3 peer reviewers. 10. There were 10 college alcohol researchers that reviewed the ratings, applied their knowledge, and then said, here's what we think. They sent it back, we responded, sent it back, they responded, and only when all 16 reviewers said, we got this, CollegeAIM was born. So through multiple rounds of review and revision, literally decades of research were distilled into this user-friendly tool that you heard about. This slide is ridiculous. It's mainly meant for you to go, whoa, because it shows you how many strategies are there. When Dr. Fry wrote that article in 1945, it was a really short lit review because there were no articles about effective prevention. That's changed. And so when we look at how groups, coalitions, organizations can use CollegeAIM, they can review individual and environmental strategies to compare approaches, look at what they have in place. If it's effective, great. If it's less effective, how can you find new evidence-based strategies to replace those, with the idea being that a worksheet will really help guide your decisions. The idea with CollegeAIM is you can assess behavior on campus and set priorities, pick strategies after seeing what's out there, plan how to carry out strategies and measure results, and then implement the chosen strategies, evaluate them, and refine the program. So what's the goal? Start with figuring out what are we doing. If you're on a campus, identify what your campus is doing. If you're part of a Greek organization that's national or international, what are you already offering? And so when you go to CollegeAIM, you can click on worksheet and it brings you to this worksheet. Plug in what strategies are we doing? Are they individual or environmental? Are they effective? Are they even in CollegeAIM? I think that right column is super important. What can we say about it? Do we have a policy, but everyone can agree it's not really enforced? That's a problem. Do we have a program, and we say it's required, but only about half of people do it? That's a problem. So what notes do you have about delivery strategy? And then go shopping, which sounds like a lot of fun after almost 60 weeks at home. But go shopping for possible new strategies. What aren't we doing that we could add to our plan of strategies? And if we're doing something that's not very effective, what can we do to replace it? So when you go to CollegeAIM, you can click on individual strategies or environmental strategies. Know that you can download a PDF version. You can order a booklet version, both of which are great. I'm going to show you that the HTML version on the website can really bring this to life. In the booklet, you'll see individual strategies in relative columns of relative cost and in rows of relative effectiveness. Going left to right, low, middle, high, going vertically high, moderate, lower, not effective, or too few studies to rate effectiveness. Same general strategy for the environmental side. And then if you select a strategy, you can see ratings, references, and potential resources. So if I wanted to click on age 21 drinking age, I click on it and it brings up this window with summary, notes, references, and potential resources. If you click on references, it literally shows you all the articles and anything that's in color, you can click on that and it brings you to the article. Where was that when I was in grad school doing lit reviews first? You should still do lit reviews, but this is an amazing tool to bring science to people and make sure science is getting in people's hands. You can also compare strategies. So if you click on multiple, click on strategies to print for reference or discussion. When you click in the upper right, print preview, it will bring you the whole list and it will summarize absolutely everything in either something you can print or save as a PDF. I think one of the hidden treasures in CollegeAIM is an FAQ. There's actually a shout out to FAQ saying, what specific work can we say about people in fraternities and sororities, for example. But if you go to FAQs, they're organized by monitoring campus issues, selecting and implementing strategies, responding to potential objections or challenges, and about CollegeAIM itself and ongoing research. I think the most important sentence in CollegeAIM is on page 5 of the PDF. Or booklet. It says, consider a mix of strategies. Your best chance for creating a safer campus could come from a combination of individual and environmental level interventions that work together to maximize positive effects. When I hear a group say, we offer the Alcohol Skills Training Program, ASTP, my first reaction is, great. What else are you offering? Because it takes that package deal. In CollegeAIM, they say some of the most effective strategies are carried out in the communities and states surrounding the campuses, such as enforcing the minimum legal drinking age. Campus leaders can be influential in bringing about on-campus environmental changes that protect students. Yet to achieve this success, you've got to partner with leaders and coalitions in your community and state. I would expand that to national. If you are working with Greek Life in a campus, the role you play as an organization or for any of the participants in the organization you represent can go a long way to impacting what students say and do. So my last slide, what we've heard so far, people love the direct access to articles. They all agree the worksheet is essential because it really means let's honestly take stock of what we have, what we might need. People love the FAQ page. They say, HTML is so vibrant. It really does connect you to the research, but don't sleep on the PDF version or the booklet. That can be an important tool as well. They can be found very helpful in prioritizing in a tough budget climate. And we've also heard people say, wow, where's the cannabis intervention matrix or the sexual assault prevention intervention matrix? We do hear that it's been so useful. People wish they had that for planning as well. That was a whirlwind. We're gonna have time for Q&A at the end. But with that, I'm gonna tag over to Jessica Krantz, who's gonna talk about what's new, what's changed, and what's on the horizon. Jess, I'll tag over to you.
All right, great. Thank you, Jason. Well, if you want to go ahead and move to my next slide, since you set that up so well. As you alluded to earlier, I'm going to do a little bit deeper dive on some of the ratings, though not all of the dimensions that Jason said are highlighted in CollegeAIM. I specifically wanted to focus on effectiveness and relative costs, as those are the two major dimensions on which the different strategies are organized. So I just want to provide the context of what do we mean when we say higher effectiveness? How did we reach that point? And there are some differences across the environmental focus versus the individual focus strategies. And again, the environmental focus strategies are meant to apply to the entire campus and all students there, so laws, policies, broad programs, whereas the individual focus ones are really targeted to individuals and groups. So the environmental focus team really did just try to make relative ratings based on their assessment of the literature, as well as the reviewers' assessment of the literature of what had higher, moderate, or lower effectiveness. Whereas on the individual focus side, we made more of a numerical basis, right? If 75% or more of studies showed a reduction in alcohol use, a reduction in alcohol consequences, or in certain circumstances showed a slower progression to the onset of alcohol use, or basically a less steep slope in the increase of alcohol use over time for those who received the intervention, that was considered to demonstrate a positive effect, right? It had an impact on their alcohol use and the consequences they experienced. So if more than 75% of those studies found that, then we put them in the higher effectiveness category. For relative costs, there were actually not a lot of studies published or information out there on how much it was costing each campus to implement these different strategies. And so we were having to draw on a lot of our own personal knowledge, talking with our colleagues, finding out things anecdotally, to try to make these relative arrangements based on how much it typically costs for one FTE, for example, to hire and train a person to deliver different interventions. In terms of barriers, those were largely the same across the two teams, but did differ in that because the environmental focus can be at multiple levels, including at the state level, lobbying for laws, those barriers were noted. And then amount and quality of research also differed across the two teams. There was significantly more studies looking at changes over time in drinking behavior and the individual focus strategies. So we had a higher bar in terms of what we said had the highest level of research. So 11 or more studies versus 5 or more studies on the environmental team. Next slide. So I just again want to say that since I was on the individual focus strategies team, I do not know as much as some of our colleagues on the environmental focus strategies team as they do about these individual approaches, but I did want to highlight the changes from the 2015 release of CollegeAIM to the most recent update. There were 3 new strategies. All of them in the mid-range cost column, you can see highlighted there in green in the CollegeAIM booklet, with 1 in the higher effectiveness category and 2 in the moderate effectiveness category. That higher effectiveness strategy was establishing minimum unit pricing, so minimum pricing for a unit of alcohol. And then the 2 other strategies were conducting reward and reminder or mystery shopping visits and enacting false or fake ID laws. And again, that would be something likely happening at the state level. Next slide. One strategy that moved to a higher level of effectiveness, so from lower up to moderate effectiveness, was restricting alcohol sponsorship and advertising. And that certainly, I think, is something that you could think about in relation to bars around campus or around chapter houses and how you might partner with those establishments to restrict advertising. One strategy that moved to a lower level of effectiveness than it was previously rated was retaining a ban on Sunday sales. In terms of individual focus strategies, there were, wait till Jason moves to the next slide. There we go. Perfect. 4 new strategies that we included in the update, and you can see those highlighted in green. 3 of those were in the moderate effectiveness category, and 1 actually had too few studies for us to rate effectiveness because we felt it was important to have at least 3 studies on a particular approach before we felt confident rating its effectiveness. One of those strategies was decisional balance exercises, which is basically weighing the pros and cons of drinking behavior versus changing drinking behavior. And that was a lower cost strategy. The science also supported protective behavioral strategies alone as a potentially effective strategy that was placed in the moderate effectiveness category, again, lower cost. And that's really highlighting what are steps that students can take to reduce their risk before or during drinking. 2 different commercial or branded programs that were identified as Alcohol Wise, which I do need to say includes eCheckup to Go, another commercial program within the Alcohol Wise program, and eCheckup to Go is rated separately in CollegeAIM. Alcohol Wise provides additional education beyond the feedback provided in eCheckup to Go. And the drinking assessment and feedback tool for college students. And that was the one where there were too few studies to rate. So hopefully by the next CollegeAIM update, there'll be more studies on that approach. One strategy we previously rated moved to a higher level of effectiveness, and that was in-person's norm clarification alone. And that is to be differentiated from maybe a normative campaign where you've advertised showing students, this is how much a typical student drinks on our campus, which is typically something done at an environmental level, or a personalized normative approach, which really targets to the individual student, how much they're drinking, how much they think other students drink, and then the actual norm on campus. The in-person norms clarification is more of a group discussion. That was in the moderate effectiveness category. And then there were two strategies that previously had too few studies to rate. Alcohol 101 Plus, another commercial program, and blood alcohol concentration feedback alone. Alcohol 101 Plus was placed in the lower effectiveness category based on the available studies that we had. But blood alcohol concentration feedback, or telling a student what their blood alcohol concentration, or BAC, was, maybe at the start of a party and the end of a party, and incentivizing having lower BACs, was actually found not to be effective. And anecdotally, I've heard from colleagues, basically became a drinking game, right? Trying to achieve higher BACs as opposed to trying to maintain a lower BAC. So especially in our present moment, where many of us are not fully offering services in person, I will say my own county that I'm living in moved from the higher risk to the extreme risk category for COVID-19 just yesterday. So that's probably going to scale back our services. I think it's important to note what in the CollegeAIM highlights strategies that we can be using without in-person contact. And these are all just higher effectiveness strategies. So in the lower cost range, self-monitoring and assessment alone has been found to be effective. So simply tracking how much you're drinking, the types of drink, the situation you're in, the consequences. There's an example of a tracking sheet there on the screen. Just that self-monitoring, checking up on your drinking alone has been shown to reduce drinking. Goal and intention setting interventions alone have also been shown to be effective in reducing drinking, or consequences, or both, but they're a little bit more variable, hence the question mark. They all look a little bit different, but all have at their center this notion of setting a goal or an intention for behavior. And that goal or intention may not be related to drinking behavior itself, but it might be for a behavior that drinking could interfere with and therefore might reduce drinking. Another strategy are personalized feedback interventions, and eCheck 'em to go is again a commercial program that is a specific personalized feedback intervention, but both personalized feedback interventions broadly and eCheck 'em to go are rated separately within CollegeAIM. Up on the screen is an example of a personalized feedback intervention that my colleagues and I developed at the University of Washington, and it highlights information on the students' own drinking, their normative perceptions, like how much they think other students are drinking, as well as their blood alcohol level, their beliefs about alcohol, their consequences, protective behavioral strategies they've used and have found effective, and so on. One component of that is a personalized normative feedback, which I mentioned earlier, which Jason, yeah, perfect. Again, just that part alone, just presenting what a person believes other students are drinking and what other students are actually drinking in terms of the quantity and frequency, has been found effective to reduce. And this changes in normative misperceptions are also found to be sort of the causal mechanism in the broader PFI intervention. So that's a particularly salient intervention. In the mid-range cost strategies, want to call attention to alcohol skills training programs. I know that these both of these and brief motivational interventions can be delivered over Zoom or other web conferencing systems. You can have sort of the same interactive experience, although it is different. And I also know that Alcohol Skills Training Program is implemented in a number of different chapters that I have worked with personally, and I'll actually defer to Jason maybe later to speak more about his experience and knowledge of that. But that has had a pretty significant uptake. So you might already have resources available to you in supporting that program's implementation. Brief motivational interventions contain much of the same content as the ASTP, but delivered in an individual format. And then last in the higher cost strategies category is AlcoholEDU for first-year students. And this is typically applied, again, to all first-year students, regardless of if they're in a fraternity or sorority or not, and is it contains alcohol education as well as some of the personalized feedback elements that we talked about in terms of other interventions. And with that, I'll hand it over to Alicia.
All right, thanks, Jessica. So I will be coming in really from that practitioner sense of using CollegeAIM. So really kind of looking, I know we're primarily are for fraternity and sorority folks here, but also I see some health promotion folks in the chat. So starting first and foremost with what is CollegeAIM? It's prevention. So for those that aren't familiar with that concept of prevention in this area, so most health promotion offices really tend to focus on the primary and secondary levels of prevention. So really looking at how can we prevent negative outcomes from happening regarding alcohol, or if somebody's already starting to experience some negative outcomes, so interactions with conduct, alcohol poisoning, how can we step in and intervene before it gets worse or turns into a dependency or addiction issue? Another common framework that folks use in health promotion is the Institutes of Medicine protractor. In the prevention side of the house, it's really that first end you see in the image. So whether it's entire population prevention efforts or selective where it's very targeted subpopulations, which is probably going to be where a lot of the stuff we do in Greek life tends to fall, and then indicated for targeted individuals that are increased risk. So maybe particular members and chapters that are your higher risk folks that you need to have a more intentional conversation with. A couple other frameworks and models that we use in public health and health promotion is the socio-ecological model and the strategic prevention framework out of SAMHSA. And you can see a couple images of those on the next slide just to give you kind of a visual. Starting with the socio-ecological model on the next slide, again, just a quick primer for those that aren't familiar. So socio-ecological model is really looking at, in this context, what are the pieces of a student's life, so to speak, that impacts their behavior and their decision-making? So whether it's their individual knowledge and attitudes, to the people they interact with every day, to the organizations and social institutions they're a part of, all the way up to policy, so university policies, national, state, local laws. And on the next slide, you can see where it comes into play with your colleagues in health promotion. You know, very similar to what CollegeAIM really reinforces, the most effective approach is when you're mixing individual and environmental strategies. And this also looks at the perspective of, you know, I think there are still a little bit of misconceptions around health promotion being very presentation focused, individual focused, which is great. And I'm not knocking that. That's a lot of what I do. But it also justifies the work around advocating for policy changes, community work, environmental level work, because we know that those things also play a role. Our students aren't in these on-campus bubbles and never leave our campus. They're going out into the local bars, they're having off-campus house parties. So this really justifies doing more with that. Something that's a little bit more health promotion focused on the next slide. So the Substance Abuse and Mental Health Services Administration, they have a framework that we use called the Strategic Prevention Framework. This is really looking at, from a substance use perspective, understanding what the data is, the capacity you have, so staffing, financial resources, things like that, all the way to planning what you're going to do, implementing it, and then evaluating it. And even from what, you know, Jessica and Jason have already said, the strategies and the way that CollegeAIM is used really fits nicely into this. So it helps guide that planning aspect especially. And then when you're using evidence-based interventions, some of them already have evaluation pieces tied in, or they are so nicely set up to make the evaluation process a lot easier. But one thing that's very focused from a bigger picture level that some folks in Greek life may not be as involved with. The next slide, something that especially health promotion folks or AOD folks deal with is the Drug-Free Schools and Communities Act, especially as it were in relation to compliance. So if you can just take a click to the next slide. Right here. So on the next slide, really quick summary. So this is an aspect of the Department of Education Edgar Part 86 regulations. And then on the next slide, what it says in the text is universities and institutions of higher education have to adopt and implement drug prevention programs, not treatment programs, prevention programs. So this is actually a regulation that we have to meet and we have to be in compliance with. The prevention program is a vaguer term, and we can talk more about that later, but prevention programs to prevent unlawful possession, use, or distribution of drugs and alcohol. One big piece to this, and some of you may actually be pretty familiar with this or sit on these work groups. On the next slide, I really talk about what we call the biennial review. So the biennial review is part of our compliance pieces where we have to make this report every 2 years. And it's an overview of our ATOD program, so alcohol, tobacco, and other drugs. So looking at the programs, the policies, but now also their effectiveness. I think there used to be a concept years ago for some institutions that this was very much a check the box type of report. But over the past few years, it's actually gained a lot of attention from your health promotion folks that this is something that can be really useful in strategic planning. But on top of it, from a compliance perspective, if there are institutions that are under Title IX investigation, more often than not, the biennial review is also asked to be seen in those investigation processes. So we're really looking at not only are we reporting the programs that we're providing, the policies we have, but how effective they are. Are they being, like, for example, our student code of conduct violations, are the sanctions being delivered equitably? Are people being charged for the same violations, or are there differences in that? And best practice with this, just like with CollegeAIM, is this should not be done by one person. This is a project that really is best in a standing committee or work group. So not only having your health promotion folks doing this, but also your student conduct colleagues, your Greek life folks, your campus police. And if you could go to the next slide, some tips on CollegeAIM. So again, this is really a team effort. So if you are not necessarily the health promotion person on your campus, asking yourself, who deals with alcohol on my campus? Who's providing the education? Who's creating these policies? Who's enforcing the policies? So some of the folks that I mentioned, but also, talking to your folks in housing, your Dean of Students office, potentially, student activities. Again, really emphasizing this mix of individual and environmental strategies. Individual strategies are fine. They're really intentional. And I think especially as students are coming back to campus in the fall, they're really wanting that social connection and social interaction and feeling a part of their campus community. So those individual pieces are going to be important, but the environment also plays a role in their decision-making when you can't be there. And then finally, the website. It's interactive, it gives citation links, it's substantial FAQ, highly recommend it. And then my last slide before we get to Q&A, some examples of how you can actually use it. So you're like, okay, well, we talked about this, so give me some examples of what I can do. So really thinking about it from the Greek life perspective, CollegeAIM strategies, you can use that to drive new member orientation or education. So how can you talk about norms, clarification, and orientation? Can you do something around goal setting for the semester as these folks are coming into these new chapters and new organizations? How can this shape your risk management training? I know all of you do risk management training because our office helps provide that every year. So how can you incorporate these things so easily and so nicely into the risk management process? But then also, I'm sure you have ways of finding out who are your higher risk members and how can you use this to guide those interventions. Maybe your health promotion office already has an e-checkup subscription, for example. You can use that as part of the intervention process. Or maybe you see the AlcoholEDU as being required for all incoming students, maybe using some of that data for conversations. A couple other pieces. So justifying the maintenance and allocating of resources for enforcement. So it's great to have policies, but it's one thing to have a policy versus actually enforcing it. So being able to enforce these things, enforcement or creation of social host policies, and then of course a huge one for those folks that are allowing alcohol at social events, having responsible server training be required of anybody providing alcohol at these events. So these are just some easy examples that maybe you're already doing. But with that, I really want to leave time for Q&A. So Jason, Jessica, I will hand the floor back over to all three of us.
Well, I will say our goal was to stop at the 45-minute mark for questions, and I show we're exactly at the 45-minute mark. So well done, everybody. And before I stop sharing my screen, just so that you have our contact information, if there's an article we referenced, an idea you wanted to follow up on a bit, each of our email addresses is right there. And I'm sure certainly if there's any follow-up needed, we can be sure to do that with you. So I'm going to stop sharing my screen. Beth asked me to take a look at what's in the Q&A and address questions where we can. One question that came in, I'll take these chronologically, is, are there any programs in CollegeAIM that were student-led? I will ask Alicia and Jess to jump in if I said any of this right, but my understanding is that's one of the areas where the research is a bit mixed. There were peers and peer delivery across a number of different studies. Basics, for example, there were a couple studies that looked at utilizing peers. More programs that are group-based, like alcohol skills training. There are some studies that show that peers are and in at least one case, more effective than professionals. Yet there were others that did not show a change. I will say this, when I look at the role that peers can play, the only thing I ever hold people to is when they say, well, peers are a cost-effective option. It's like, peers are a lot of time and a lot of investment. And when you get a good one and they graduate, it's like, oh, we have to start all over again. So I'll go back to that comment about a mix of strategies. I think that the role that peers play in health promotion and health education is huge. I don't know, and I'll ask Jess and Alicia if they feel differently. I don't know, though, that I've seen studies that say peers can be the sole source of that alcohol prevention content. Jess or Alicia, what might you add?
Well, I can start from the practitioner side of this. So our office is structured in a way that I am currently our head basics provider, but I do have a graduate student that I thoroughly train. So for me, I think the key is, how are you training and preparing these students? So actually, I was off camera grabbing something off my shelf. My students read this book before we really go and see students. So the motivational interviewing book by Miller and Rolnick, we do practice sessions, they watch me do sessions. So that's how I do it. I think, I would agree with Jason, like the studies are mixed. And I think the key to that is because it's really based on training and preparedness and ready to do these things. But that's from my practitioner experience.
Yeah.
Go ahead, Jess, sorry.
I was just gonna say, I don't think I have much to add. I think you captured it, Jason, and that the supervision really is key, and that can be very time intensive to make sure that that's done right.
A question came in. Can you talk about using a program / tool / training as prevention versus as a sanction or diversion, and how this should be considered?
Yeah, I mean, I'll say on my campus that, it's not exactly ASTP, but there is a group-based alcohol prevention intervention implemented for all chapters in the fall typically, and that's not sanction-based, it's just broad education and information about alcohol that also has a specific focus on reducing the incidence of sexual assault. So that's implemented. Again, it's not strictly ASTP.
Go ahead, Alicia.
Well, again, I'll speak from my practitioner experience on this one. I think, again, I hate giving these gray area answers, but I think from my experience, we work a lot with student conduct here, and we provide basics, and it's really having a sit down conversation with conduct, and they're really open to it about that readiness and the level of risk. So for us, We have some students where it's like, okay, it was just like paraphernalia in your room. Let's go through e-checkup, give them the option to speak with Gatorwell if they want to. For students that maybe it was a higher risk situation or conduct is felt out like, okay, maybe this person needs a more intentional conversation. That's where basics plays a role. But we also have a conversation of where does counseling come into play? And maybe this is a better conversation as a substance abuse evaluation for our folks over in counseling. So I think it really has to be an intentional conversation. And for us, like with basics, it's very non-judgmental. So I always start off with my sanctioned students, what basics is. And I think that kind of reduces the frustration and maybe some of the concerns that they have. But that's from my experience, but I'd like to hear Jason's thoughts if he has any.
I'm going to keep it lightning round just because I'm aware of the fact we have more questions coming in, but I would say have both available. It shouldn't be that the only way to get an evidence-based strategy is to get in trouble. Right? So can people self-select into or choose to attend something like a basic session or an alcohol skills training program or any of the other programs that you heard about, or are they only for mandated students? The other thing I'll say is if it's going to be required, if it's going to be mandated, and there are mandated examples and studies in CollegeAIM, but if it's going to be mandated, you have to literally follow through on that. If you say we're requiring this program 100% of all new members and 95% complete it, the 5% that didn't, what they learned is stuff doesn't get enforced around here. And all the way back in the 2002 Call to Action Task Force report, they made very clear that if you have mixed messages, that affects student health. And then when you do enforce, they're like, well, why are you picking on me? That guy didn't do anything. And so the more you can focus on consistency of a requirement, of a mandate, that becomes essential. Can you talk to the comment, can you 5-minute presentation, which seems to be not true to the program evaluated by the research? I got the warning my internet was unstable. So I don't know if you heard that whole question or if I need to reread it.
If you could reread, Jason.
I will reread. Can you talk a little bit about measuring fidelity to the model of whatever program you're using? Lots of folks are calling a presentation ASTP, but are only doing a 45-minute presentation, which seems to not be true to the program evaluated by the research. This is what I get fired up about, honestly. Anonymous attendee who posted that, I agree. You know, it's frustrating because I will talk to people that say, you know, I usually start my ASTPs with a 20-minute story about my experience. It's like, no, not part of the content, not part of the science base. And don't do that. When we talk about threats to fidelity, it's when there's something that has been studied and shown, if you do it this way, it works. Some of the greatest advances we have seen in this field came when someone took a chance and tweaked something. But if you change it too dramatically, it can alter the impact of the intervention. In the alcohol skills training program, the key is if you give people information, knowledge increases, there's no change in behavior. It needs the motivational enhancement style. That's hard to do in 45 minutes. It can be done. And if you're really solid with it, it can be done. So I wouldn't dismiss a 45-minute program as not effective. But if you're saying, I'm trying to keep it true to the science, it's a brilliant point. I'll tag over to Jess or Alicia for whomever might want to add to that.
Jason, could I add one thing? I recall in our original version, and I assume I believe it's in the update too, we encourage folks, if you're going to tweak things, or even if you're going to try to use a program that may be in the moderate level of effectiveness, if you can, work with some researchers on your campus or yourself and try to get something into the peer-reviewed literature about your efforts, because CollegeAIM, and I think this will apply to the next question about beers aren't bad. We utilize the peer-reviewed literature. So the more that's out there, the more there is literature to draw from. So would you agree with that? That encouraging folks, if possible, to, if they're modifying or trying new things, to try to get that articles written about it.
Absolutely.
Yeah.
Yeah, and I appreciate you saying that, Fred, because circling back to where I said my campus isn't using ASTP specifically, we are trying to evaluate what we are doing to get that out into the literature. And I will go ahead and answer that next question about the question about beers aren't bad. That's not in CollegeAIM. I'm not aware of any published evaluations of that, but I'm very interested to read up and learn more about that and to see what's out there.
The next question, if a university is considering the decision whether to or how to serve alcohol in a responsible way at athletic and other on-campus events, what advice would you give? Channeling the environmental strategies team, I would say look on the environmental strategies matrix, and among the effective strategies is not serving alcohol at campus sporting events. So if you're saying, should we do it or not? If you want science to guide your decision, science would have cast a vote on the environmental matrix. There was a follow-up question. Does the content of the education lend itself to either prevention or diversion, or does it not matter? I'm not totally sure I understand the question, honestly. Anyone want to take a shot at that, or?
Oh, go ahead, Alicia.
Oh, no, I'll let you answer that question. I was going to follow back up on the athletics thing, but you first.
I was just going to say, I think I'm interpreting it, and I don't know if this is correctly, as is the education focused on the sanction itself, or maybe campus policies, as opposed to psychoeducation in the service of alcohol skills. So yeah, I mean, the interventions that we've been talking about aren't necessarily sanction specific, although I believe that may not be true for some of the commercial products, but those commercial products I'm thinking of aren't actually named in CollegeAIM.
Alicia, you said you wanted to make a comment about athletic events.
Yes. So, and it will be a challenging conversation. That was actually a pre-COVID conversation I had on my campus. And I think it was ultimately ideally no alcohol should be served. But some other suggestions that were brought up, very similar to the environmental strategies, no advertising in the stadium, no advertising at concession stands. So we had it so that you have to be actively searching for alcohol if you're inside the stadium, and there were only certain concession stands that sold it. We also don't allow people walking in through the stadium to serve it at seats. So we don't allow that either. But ultimately the follow-up, and I think this is another like big picture thing to tackle as a field, our bigger issue is tailgating. So for us, like, yes, there are some concerns around drinking in the stadium, but our bigger concern is how do we deal with tailgating behavior prior to the game even starting?
Mm-hmm. In the interest of time, the last two questions, just to honor the order in which they came in. Tom Bannard, my friend and nationally recognized champion for students in recovery. Good to see your name. What are your reactions to the initial studies suggesting substance use and substance use disorders are way down for college students in the last year during the pandemic? I can speak to the research I've seen, which has shown that about a third use has gone down, about a third use has stayed the same, and about a third of students use has increased. What's the narrative? Unfortunately, in a lot of pop culture publications, everyone's using more. That's not true. And so we know that the perception of norms is really, really, really important. While it's not true that most students have increased their use, despite that narrative, for those that have, we have to be prepared. And now's the time to be looking at how do we support those students that are going to be returning to campus with a potential increase in their drinking. But for, per Tom's point, there are definitely students for whom use has gone down. Jess or Alicia, before I do the last question. All right, and the last question, someone said, what tools or assessments have you used that are similar to eCheckUp2Go, but more cost efficient to colleges, as some of these colleges can't afford eCheckUp2Go? Jess, I'll tag over to you as the lead of the individually focused team.
Yeah, so this is such a great question. And I will call attention back to when I mentioned personalized feedback interventions as a generic category of intervention was rated separately from eCheckUp2Go and CollegeAIM. So I would strongly suggest looking at all of the resources listed under personalized feedback interventions generic. It'll point you to a lot of articles, some of which have samples. I know the first personalized feedback interventions that we developed at the University of Washington, I helped program in Excel and in Microsoft Publisher and some other like, desktop software programs that are commonly available on campuses. You can absolutely make a homegrown version of this. And I think the key is looking to the research and making sure that you're modeling what you're developing based on the components that are there, even if you're programming it yourself. So if you have, computer science students that you might be able to hire work study, that can be a cost-effective way of getting this done on your campus. And I'll turn it over to Jason and Alicia for anything to add.
I just want to share this, echo the sentiment you said about look to the research. And what NIAAA and CollegeAIM has always made clear is that it doesn't squish creativity, nor does it keep us from trying new things. But if you try new things, see if it's an evidence-based strategy. I think a lot of, it's cool if people are like, oh, I heard about a new program. Again, what does the data say? If there are no data, you can add to the literature. So I would just echo that. Alicia, you were going to say something too.
Nope, spot on. Couldn't agree more.
With that, we will thank you all for your attendance. I'm going to tag back over to Beth Bagwell, who will wrap us up for the day. Thanks, everybody.
I just want to thank everybody for joining us today. This has been so exciting. Our panelists are fabulous. They're very renowned and highly sought after. So we really appreciate you all being here today. Again, we wanted to thank NIAAA, AFA, for your time. For those of you who are asking about the recording, we do have a recording from last week's webinar on the ITGA website. Under professional resources, you'll find webinar. So it's the one at the very top. This will be up probably in about 3 days. It takes a little bit of a time for a turnaround. Look for an email from me sending out the survey today that will help us know what we need to continue for future webinars. We really appreciate your time, and stay safe out there, and we'll see you later. Thanks for joining us. Bye.